So Kendall, thank you again for making time to speak with me. I'll introduce myself again. My name is Milpa, and I'm being joined by Julie, Lucia, and Michelle. And I would love to introduce you and provide you with an opportunity to give us a little background about your career and yourself. So I'm being joined by Kendal Wilkie. She is a registered nurse at the UCLA Medicine Pediatrics Comprehensive Care in Santa Monica. And Kendal is also she's a clinical nurse working on the needle anxiety program. Kendal, will you please be able to introduce yourself as well?
Sure, of course. My name's Kendal. I've been a nurse here at UCLA for the past 15 years. I've been at the ETC clinic where we're doing the needle program for the past 2.5 years now. And yeah, it's just lots of interesting opportunities at the clinic. Definitely, we see everybody from newborns to the elderly. It's a fun place to work. Lots of challenges.
Great, thank you so much for your time, Kendal. And we want to provide you with a brief summary of why we are doing this interview. So we are interviewing you to discuss the needle anxiety program at UCLA, to learn about the program, what you have learned about the needle anxiety in the neurodivergent and in the community with disabilities during the COVID-19 pandemic. We are specifically interested in your perspective as a registered nurse working on the needle anxiety program, and what we can learn from the program as we try to increase vaccine confidence in particularly for COVID-19 in the community with disabilities. Mm-hmm. So my first question was, will you be able to briefly tell us about your role in the needle anxiety program?
Absolutely. Dr. Kuo approached us last year regarding doing the program. There was a lot of things to put in place kind of from a nursing perspective. We had to be signed off from ambulatory. We have to have certain emergency equipment in place. We have to have certain training for all the staff. So once that was in place, we went go live in August with the program. So it was a little bit of some stuff to set up before we went live. But definitely Dr. Kuo has been the advocate for this program for a while now. So it's really nice that it's actually come to pass.
And can you tell us a little bit about how has this program helped the neurodivergent community during the COVID-19 pandemic and the vaccination efforts with relation to COVID-19?
So definitely, I mean, not just with the COVID pandemic, we haven't seen too many of our patient population requiring the anxiety program for COVID vaccines yet. We've only had one person, but definitely for general lab work for vaccines, it's, you know, there's a certain patient population that it's very hard to get those kind of orders performed, and some patients need monitoring for drug levels, things like that classically they haven't been able to. So it's been a really good opportunity. The families have reacted very well to it, and we've had some successes, we've had some failures too. Some patients we were not able to administer the medication, but we've learned from everything. We've evolved our program, we've evolved how we approach it with families and things. So we're constantly learning and improving the process. But definitely, I think particularly with the COVID vaccine, it's going to be absolutely amazing to reach out to our patient population to be able to vaccinate.
Great. And overall, can you tell us how many patients have participated in the needle phobia program to this date?
I can. So I put together some information. I can send it to everybody in an email as well. I apologize for not getting that to you before. And we have done actually 14 patients to date. We have about another 5 more over the next month or so, but 14 to date, of which we have successfully given vaccines and done lab work on 8 of the patients. So it's greater than 50% success rate. We are still working, as I say, there are areas to improve upon all the time. We're learning and evolving, but it's been very successful for a number of patients.
Great. And can you describe some of the reasons why patients have stated they have needle anxiety?
So for some of our patients, they've just had bad experiences with coming to the doctor's office. They've had, maybe a vasovagal episode after they've had labs or vaccines in the past. And when they were children, they had bad experiences. So it stays with a lot of patients for a lifetime. For some of our special needs patients or our autistic population as well, there is that resistance of it's a change in their routine, it's a new place. going to the doctor doesn't always have a positive thought behind it. So I think that's some of the barriers to why patients have this anxiety, even just generally walking into the doctors, let alone getting vaccines and lab work.
And how can you describe the results of the program and some of the successes?
Absolutely. So what we found the best successes with is obviously reaching out to either the patient or the patient's family before they come in to do a really good rundown of what our program offers, exactly what to expect when they get here. Particularly for some of our special needs patients, we want to minimize the amount of time they're in the waiting room. We want to minimize the amount of time they're in the clinic. So we don't want to bring them back to a room and not be ready to go. So it's having that conversation a week or two before with the family to make sure they understand this is what we're going to do. This is the medication. This is how we administer it, that we're going to monitor you closely. We're going to monitor you afterwards as well to make sure you're back to your baseline. So it's that no one walks in that they're not prepared that, oh, I'm going to be here maybe for 30 minutes to an hour, that not to know what to expect. Because some of our patients, even though we go through it, with just getting near them to give the nasal spray, which is how we give the medicine, can be very challenging. So one thing we have learned is to speak to the families beforehand and, at home, try using a saline spray, just so that they're used to that concept of having something sprayed in their nose. We've learned that through trial and error. So it's a process, yes.
I see. So one of the, what I'm hearing is one of the important strategy is to help prepare the families and the caregivers before they come to the clinic.
Absolutely. That's been paramount, so that they know what to expect, so that they can, and we also want to encourage them, bring things that make the patient feel more comfortable, iPads, earphones, anything that can make them have a more positive experience. Absolutely. And we also want to work with them on, keeping the patient to a routine as much as possible. We don't want them to have to come in when it's their lunchtime, when it's, time that they would normally be doing something else. So there's a lot of different factors to consider when we're scheduling as well.
Great. And what are some metrics that do you use for this program to measure the success?
So we've been keeping count of basically the amount of medication. We can give between 5 to 10 milligrams of sedation. So we've been monitoring how much we've given and what our success rate was, whether with the sedation they were able to have the procedure done, whether they were able to have vaccines and lab work, just lab work. So we look at every side of it, whether we're able to even administer medications, to carry out orders. So we're monitoring and measuring all of those.
Great. And what is important to know regarding working with families and patients with disabilities and needle phobia while still promoting vaccination?
So it's important that everyone's on this, that we're all working towards the same goal. We want to help, promote that vaccines in patients, and obviously get the families just understanding the process, and definitely that we want to, our goal is to help to make that happen, really, and that's what we strive to do. We do prepare the families that it's not always successful. We don't want to be saying that, oh, they'll come in, they'll get the sedation, we'll get everything done, everything will be good. That's ideal, but it doesn't always happen. So we always want people to have at the back of their mind that if it doesn't work, it's okay. It doesn't work for everybody. But definitely it's been such a boost to make sure that we can reach out to this patient population and assist them to receive vaccines. It's so important.
And what are some strategies that do you utilize to meet the patients and the caregivers in the middle?
So in the middle, in terms of?
In middle of hesitancy for vaccination, needle anxiety, but also providing the importance of vaccination.
That's it. I mean, definitely, they generally have a meeting with the doctor who's placed the order, who's obviously spoke to them regarding vaccines. And we're just, working alongside the doctor to work with the family as well, to promote what the best thing for their patient, to make sure that they understand everything regarding vaccination, potential side effects, everything like that. But also, risks and benefits. We want to explain and make everything clear.
And according to you, why is it important to discuss needle anxiety with your patients, especially for COVID-19 vaccination or other vaccination efforts?
So we want to basically, with regard to needle anxiety, we want to understand, how is their anxiety presenting? Is it that they've had a negative experience, that's what they associate it with? Do they have vasovagal episodes, everything like that? Because we want to, make sure that they understand the importance, they want the vaccine, that they understand how important it is, and just how we can help them to meet in the middle. I explain to them the process. We'll have you laying down, we'll have a nice quiet room. we made it very clear that when the patient gets to the clinic, there'll be no vaccine equipment, no lab equipment in the room. So that way they can relax in a comfortable environment before they're introduced to any of that. That's very important to us.
And can you provide us with an example or an anecdote of working with a patient with disability and or their family caregiver who has needle phobia?
Mm-hmm. So we've had a few actually, and we had one that does spring to mind. His mum was wanting him to be vaccinated, but they'd had a negative experience when he was a child. He'd received a vaccine and spiked a very high fever afterwards. So she was understandably anxious regarding the vaccine. So we spent a lot of time talking through before she came in about the vaccine. And then when he came in, we let him, we work with the parents. Once they get in the room, we say, how are things? Shall we proceed? And they said, can we have like 5 or 10 minutes just for him to acclimatize? So we did that. We came in when the parents were ready, and it's taking the time. It's not something you can rush. It's not we walk in, right, here's the sedation. We want to get time to kind of bond with the patient and the family. We want them to explain as much as we can what we're going to be doing and work with them. Because if we just go rushing in to try and sedate, they're going to be fighting us, they're going to be uncomfortable, they're going to be agitated and upset. So it's taking the time to really work with them and the family, put them at the end.
Yeah, and I want to expand on that. Can you provide us with some of the strategies that you use to communicate with these patients and families during this process?
So like I say, the time before they come in, we talk to the family on the phone. When the patient comes in, some patients have communication devices. Somebody had through the iPad, we could communicate with him via that way. Or the parents will use a sign language or something like that. So sometimes it's the patients doing the communicating for us, but we always address the patient, whether they have the understanding or not. We always want to talk to them, include them in everything we're doing. We tell them what we're doing, and we work with the parents to, how can we make sure he understands that I'm going to be touching his arm? How can we understand I'm going to be approaching him to give him a spray? And even doing, because we want vital signs beforehand, so we want to make sure the patient is comfortable that we're going to be touching their arm, we're going to be touching your finger. It's constant explanation and working very much with the family for a lot of patients just to make sure they're comfortable. Sometimes the parents will put on the pulse ox probes, the parents will help us put the blood pressure cuff on. The parents are really involved, and that's what we want. It's like a team approach. That way the parents are involved, and that's, I think, when we have the most success.
And does this strategy differ based on the age of the patient, or is it very similar?
It's very similar, very similar. Obviously, it's tailored to the younger patients. We approach it a little differently, but each patient is individual, and we just tailor it to how the patient is on the day.
And as a clinical nurse, what are some strategies that do you use to work with these patients and family members with needle phobia, specifically in terms of supporting them with stress management, with reducing some of their anxieties, to getting buy-in to get vaccinated? So can you talk about your communication and some of the conversations that you have with these patients and caregivers regarding that?
Definitely. I mean, we want people to be empowered with knowledge before they come in. We don't want them to say, and we never want them to feel that we're pushing something on them. It's their right always to refuse at any time if they don't want anything. But we want to make sure that they have the full information, the full education. We have information leaflets we can give to patients when we vaccinate. And like I said to you beforehand, the phone call that we have with the family or the patient beforehand, where we can go through that. What are your concerns? What questions do you have? How can I assist you in answering? Let me tell you more about the vaccine that the child is having. Let me tell you more about what the lab draw involves. Just really, I think that's the biggest part of it. It's empowering them and making sure that they're part of the decision-making process, that they're really involved and have a good understanding, that they're not feeling, well, I should have this done, but I don't really feel comfortable. We're making sure that they really are involved and really have that support to understand what's going on and to really be I can't get my words out today, but really be involved in the decision making process and really be educated too. I think that's the big part of it.
And in addition to the needle phobia, are there any other reasons why, in addition to needle phobia or having a previously bad experience with vaccination, are there any other reasons why patients or family caregivers are hesitant to get vaccination?
I think sometimes, the media plays a big part in it. Definitely, that oh, the MMR vaccine is bad, or, you know, the COVID vaccine isn't real. There's a lot of media influence for people, definitely. And that's why we ask, you know, do you have any questions or concerns? Can we help answer any of these things? We haven't had too many with the COVID vaccine, but you know, the media is negative about one thing, positive about another. So I think that's where a lot of the hesitation and misunderstanding does come from. So we want to alleviate those fears. We want to answer to the best of our capabilities, and like I say, we want them to make an informed choice. We want them, we don't ever want someone to feel that, well, you must have this vaccine. It's always their choice, but we want to empower them to understand to the best of our knowledge to really make a good informed decision.
And what are some resources that you provide to these families and patients who have needle phobia or even have vaccine hesitancy?
So, like I said, we give every patient, when we give vaccines, we have fact sheets for every single vaccination. It explains all about the vaccine, what side effects to look for, and also the schedule of vaccines, because some of them are 2 series, 3 series. So we always want them to know beforehand that if you're going to get that HPV, there'll be a follow-up shot in 6 months. If you get this vaccine, there'll be another shot, so that they don't think it's one and done and that's it. We want them to understand if there are a series of vaccines. But definitely give them the fact sheets, let them have time to read them too. Don't just hand them, they say, let's do the vaccine. It's making sure that they read everything. Do you have any questions, any concerns? So yes, we have fact sheets for the COVID vaccine. We have information sheets for all the vaccines that we give.
And are these fact sheets or information sheet more tailored to the age group of the patients or the disability of the patients?
It's a general form for everybody. They haven't been adapted for different patient populations. So generally it would be for the family or caregivers of patients, really, that they're tailored towards. But we obviously want to make sure we're talking to our patients that, do you understand what I'm giving you today? Do you have any questions about it? Absolutely.
And we want to hear your recommendations and suggestions for other healthcare providers who work with people with disabilities and their family caregivers, but who do not have access to needle anxiety program at UCLA. And we want to hear your suggestions and recommendations for these primary healthcare workers.
So I think one of the biggest things I've learned is allowing lots of time. I think time is the most precious resource, and it's something we don't always have in the clinic environment. But it's taking that time to really sit down with people and to not try and rush. The more you try and rush patients, they pick up on that, and it makes them uncomfortable, and understandably so. So when you are working with patients who do have needle anxiety, you want to relax them as much as possible. You want a nice, quiet environment. Like I said to you, it's important you don't have your injections sitting there. You don't have your lab work sitting there. You want that sort of stuff away from the area. You want them to really relax beforehand. You want to kind of establish as much of a relationship as you can with the patient and their family. But just taking lots of time and knowing that this patient, it may take me 30 minutes to give a vaccine, because we have had some patients who've come in for sedation who ultimately didn't take the sedation, but we managed to do the vaccinations because we had them sit and relax. We took the time and we were successful in administering vaccines. It's not always possible. That would be the dream, but it's very much, it's very dependent on lots of time and lots of patience, I would say.
And we're coming to the end of the interview, and I have a few questions. One is, I understand that you haven't had a lot of COVID-19 vaccination patients who are in your clinic, but do you see a difference in the patient population who are getting COVID-19 vaccine or other types of vaccines?
So definitely, I think for our special needs population, we haven't seen too many yet for the COVID vaccine. But again, like you say, I think there's not a lot of people aren't aware of the service that we offer with the needle anxiety program. And I think it would be really nice if it was kind of rolled out to more clinics too. It would really be helpful to have that resource at multiple places, because right now we have people travel from Redondo, from Santa Clarita. It would be nice to have clinics a little more local to them too. I definitely think it's maybe not, it's not as well known about yet, I think, definitely, but it's something that we're building on. Obviously, patients come in to see Dr. Kuo. It's something that they're discussing at their appointments. So it's definitely something we can improve on.
Great. And then one last question we want to ask you, and we want to be we want to ask you, is there anything that I haven't asked you, but you think it's really important for us, for the audience to know and share with the neurodivergent community about needle anxiety and vaccination efforts?
I think just putting the word out there that there are resources for patients who do have special needs or do have severe phobias, that we can work with you to try and achieve getting people vaccinated if that is their wish. And it's just, yeah, I just wish more people knew and we were able to reach out to more people. Definitely, that's our goal. And it's really lovely when people come in and we're able to give them their vaccines and do their lab work, because it's, it can be very emotional for the parents too, that the patient hasn't had their labs drawn in years, they haven't had their vaccines, and now they're catching up. It's really lovely to feel that you're making that difference. So it's just, and letting people know that we take the time. We want to work with them. We want to work with the whole family to get this done. We're happy to talk to you, to work with you, to work with your schedule, to try and accommodate you. So definitely, it's a real team effort.
And how do people get access to the needle anxiety program, since you mentioned that people come from various different parts of the state or parts of LA County?
So a lot of our doctors that come here, because we do urgent care in the evening, so a lot of the doctors that cover urgent care go back to their practices in those locations, and then they'll reach out to me and say, oh, I have a patient I think would be ideal for the needle. So it's kind of a bit of word of mouth right now. Mm-hmm. So it would be nice to have something, other than just word of mouth, to put the word out there that this program does exist. But it is, at first we just had a few patients. Now every couple of weeks I'll get messages about more patients. So it's when doctors come, they learn of our program, then they spread it to their colleagues.
Mm-hmm. And if you have to think about a perfect world, or a world where there's no restriction or constraints with money or time, what do you envision for this program and the future of this program?
So I think definitely with more demand on this program, it would be nice to have more resources. It is dependent on an RN, because an RN has to monitor the patient the whole time. So in a, an ideal world, unlimited budget, if we had an RN dedicated to doing this, we could do a lot of patients a day. If say we did an hour and a half each patient, we could see a number of patients every day to be able to help, in obviously in an ideal world, and take that time to do everything we needed to. So it is. Mm-hmm. Yeah, that would be my only consideration for different clinics as well, is that it is time consuming for it's an RN that's their sole role. So definitely it's not all clinics have an RN full time. So that is one of the problems, one of the stumbling blocks, I'd say.
And based on that, what you just mentioned, what I'm hearing is that the time and resources such as money or RNs are important for setting up a similar program in different clinics?
Absolutely. And having the rooming space available, because a lot of clinics, we have 10 dedicated rooms. We also have our doctors doing primary care. We have infusion patients coming in. We have vaccine patients coming in. So it's it's nice if we could have a dedicated space to do this. Then that would be, that room wouldn't get used for anything else. That would be obviously in the ideal world, but that is something to definitely consider. You need a dedicated space, dedicated staff, definitely. And lots of time. It's a very time, it's worth, you need to spend time with this patient population to be successful. So that's very important to consider.
Great. And is there any training that you are providing as an RN, as a team member in the needle anxiety program, to other clinics or other community members, other clinicians?
Not at this time, no. Ambulatory nursing, they come to do the assessments of us, and they sign us off, which is their protocol. Mm-hmm. But I would be happy to work with anybody who wants some advice and some assistance, definitely, with establishing the program, because when we started it was kind of unknown. There's nowhere else that did it. So we've learned, and like I said, we've had some successes and some failures, but we've learned from both. So it's definitely I'm happy to be a resource for anybody, and to help establish more of these clinics would be fantastic.
Great, thank you so much, Kendal. Is there anything else you would like to add to the conversation we have had so far, or you think that there is a question that I did not answer, but it's really important for the audience to know?
No, I think you covered a broad range of questions. No, I appreciated that.
Great, thank you so much for your time. If my team members have any questions, I want to open the room for them to ask. Otherwise, we will stop the recording.